Welcome. This session of the Cardiac Rehabilitation series covers medicines of the heart. Medicines used to treat coronary heart disease aim to reduce blood pressure and cholesterol, widen arteries and thin your blood. Some heart medicines have side effects, and it may take a while to find one that suits you. Don't suddenly stop taking heart medication without the advice of your doctor, as this can make your symptoms worse. Work with your pharmacist by discussing over-the-counter remedies to make sure they won't interact with the prescribed medicines you're taking. Report any side effects to your pharmacist or GP. Medicines are tailored to each individual. Every person may have different combinations and doses which can require an increase or decrease over time. Do not borrow other people's medication. Some people forget to take their medicines. If you need help remembering to take them, speak to your doctor, pharmacist or nurse. Never double dose. The National Institute of Health and Care Excellence stated that diagnosing high blood pressure earlier and manage it in line with appropriate guidance will save thousands of lives and years spent in ill health. Evidence shows that taking 75 milligrams of aspirin once daily after myocardial infarction significantly reduces further heart attacks and strokes. Medications for your blood pressure are called antihypertensive medications, such as ACE inhibitors. If patients are unable to take them, there are angiotensin II receptor blockers. There are also beta blockers, calcium channel blockers, and diuretics. Some patients may find they are prescribed more than one medication to control their blood pressure. ACE inhibitors work by relaxing blood vessels whilst allowing more salt to pass through the kidneys, so more water is excreted through the urine. This means there is less fluid in the blood vessels, reducing blood pressure and strain on the heart and arteries. There are some side effects from antihypertension medication, including dizziness, dry mouth, gastrointestinal discomfort, kidney function monitoring, skin reactions, cough, constipation and diarrhea. Beta blockers work by blocking the action of adrenaline and noradrenaline. This works to slow your heart rate and reduce blood pressure, meaning your heart doesn't work as hard. Some common side effects of beta blockers include dizziness, cold hands and feet, fatigue, headaches, postural hypotension, visual disturbances, and effects on your love life. Medications which thin your blood can be separated into two categories: anticoagulants and antiplatelets. Antiplatelet drugs work by reducing the stickiness of platelets in the blood, which helps prevent clots from blocking the coronary arteries and in turn reduces the risk of heart attacks. Anticoagulant drugs work by increasing the amount of time it takes your blood to clot in order to prevent harmful blood clots forming. Some of the common side effects of anticoagulants and antiplatelets are bruising, bleeding, blood tests when on warfarin, gastrointestinal discomfort, breathing problems and skin rashes. Statins are a group of drugs which help to reduce cholesterol. Cholesterol is a fat that can lead to fatty plaque, clogging the blood vessels that supply blood to your heart, reducing the blood flow to the heart muscle, which can lead to heart attacks or angina symptoms. Statins work in the liver to prevent cholesterol from forming, specifically LDL cholesterol, also known as bad cholesterol, and can therefore reduce the risk of further heart problems. Common side effects from statins include constipation, diarrhea, flatulence, headaches, sleep disorders, and gastrointestinal upset. These are often known as water tablets and work by increasing urine production, helping to remove excess fluid. This can lower blood pressure and remove excess fluid if the heart is unable to pump as effectively, for example after heart surgery or due to heart failure. Common side effects from diuretics include dizziness, electrolyte imbalance, fatigue, headache, muscle spasms and nausea. Angina commonly occurs when blood vessels, which supply blood and oxygen to the heart, become constricted either due to spasm or narrowing. Antianginals work by relaxing and widening these blood vessels, which should in turn reduce angina pain. Common side effects of antianginal medication include weakness, lack of energy, drowsiness, flushing, headache, low blood pressure, nausea and vomiting. Glycerol trinitrate, GTN, is a medication used for rapid relief from chest pain and angina symptoms. It comes in tablet form or a spray. It works by dilating the arteries and veins throughout the body, resulting in the coronary arteries relaxing and widening, improving the blood flow to the heart and hopefully resolving the chest pain rapidly. If you experience chest pain, you must first sit down. Have 1 to 2 sprays of GTN spray under the tongue or dissolve 1 tablet under the tongue. If the pain is no better after 5 minutes, have another 1 to 2 sprays of GTN spray or dissolve another tablet under the tongue. If the pain is no better after a further 5 minutes, call 999 and have another 1 to 2 sprays of GTN spray or dissolve another tablet under the tongue. Common side effects of GTN include drowsiness, dizziness, weakness, lack of energy, flushing, headache, hypotension, nausea and vomiting.